Live from the Carl Chevrolet Studios in West Des Moines, this is Iowa Live.
Welcome back to Iowa Live, everybody. Joining me in studio right now, Dr. Naveen Gupta from ANP Foot and Ankle Clinic. Dr. Gupta, great to see you again, sir.
Great to see you.
Now, we have been explaining the procedures that Dr. Gupta and ANP Foot and Ankle Clinic do to heal wounds from the knee below, and you really get into treating the person and treating the wound specifically, don't you?
That is correct. We've seen wounds, people come in with wounds that they've had for 3 years, 5 years, 6 years, and we've been able to help them and heal these wounds that have been stagnant and non-healing for so long.
How can people live that long without having a wound that heals? What's the real cause of that?
The wounds are being treated, but there are things that maybe not getting done on the sidelines. Sort of, for example, when a person has a wound, they're usually going to have a lot of swelling.
Okay.
If you have swelling, it's going to stretch the skin. It's going to push the skin. So if you blanch, put finger on your hand and the skin blanches, okay, that circulation comes back when you take the pressure off.
Okay.
But if you have swelling from inside, you're getting pressure from the inside. That skin is sort of blanching from inside.
Okay, and by blanching you mean?
The circulation, the capillaries are getting shut down, so you don't have flow to the wound bed.
That area, yeah.
To that area.
Okay.
So your circulation, your ankle brachial index or segmental pressures could be perfect, but the wound bed is not getting that circulation, or that area is not getting circulation. It's kind of like saying, it's been storming and raining all over the place. How's your backyard? That's your wound bed.
Got it.
Okay. If you're not getting enough blood supply there, it's not going to heal. If your skin is stretched out so thin, it cannot heal.
All right. So what can you do in that case? Because you can treat this. You have a plan.
Right. So what we do is start with the compression wraps. I mean, of course, we're going to treat the wound. We're going to clean up the wound, and we're going to put the compression wraps on.
And that's those stretchy.
The ACE bandages
right,
is what they call.
Okay.
Or compression wrap, compression elastic bandages.
Okay.
So when we use that, we're going to leave them on, and we don't have patients take them off because they cannot wrap them back up the way we do it. I mean, the way the medical professional is going to do, we're on the other end.
Yeah.
And if you're trying to do it from this side on your foot, in your leg, it's very, very difficult. So if that person has to go and change their bandages next day, that ACE bandage is not going on correctly.
Okay.
It's just, almost impossible. There may be, a few people that are good enough or have the experience that can do it, but in general, the person's not going to be able to get that ACE wrap on.
And that's key to the healing process,
That's
isn't it?
key to getting rid of the swelling and therefore getting the healing process started. Okay? Just getting rid of swelling is not alone going to do it.
Okay.
Okay? But that is going to be the basic point to start the healing process. Now we can clean up the wounds. Now we can do whatever other additional therapies and treatments we can do, and we'll talk about that in the future here.
Okay. So it's not uncommon for somebody to come in and visit you on a Monday and then have them come back on a Tuesday, or that's common.
Right. It depends on the condition of the wound. Sometimes I will have them come in every day for a few days, a week, that we're going to clean up that wound, we're going to get rid of the dead stuff, but we can't get all of it done in one day or at one setting. So we'll clean that and we'll wrap it up with some moisturizing ointment and stuff, and come back, and then we'll clean up the little more.
Because you could clean it up better the second day, couldn't you?
Yes.
In a lot of cases,
that necrotic, that dead stuff
Yeah.
is a little bit softened up, it's easier to get it off without damaging the good tissue under that.
All right. So there's a whole plan of action, and they're going to come and see you as necessary.
as necessary. There is no pre-made plan that I'm going to see you in a week. No, if your leg, if your foot needs assistance much more frequent, then that's what we're going to do.
Okay.
The goal is to get this wound to heal and not just drag on and on and on.
Okay, so yeah, put an end. If you have a wound that is not healing, if people want to find you, very, very easy to find them and make an appointment. feetdr.com, feetdr.com. It is ANP Foot and Ankle Clinic in West Des Moines. We can treat it. Thank you, doctor. We appreciate it.
Thank you.